This is your Oncocare advisor and Dr. Raghav here. We are continuing to talk about colon cancer. We covered a few aspects of it, especially the staging and high-level things like what questions you should ask. Now, as I've always mentioned, colon cancer is a very treatable cancer. To some extent preventable, but if found, very treatable. But it has to be found in an early stage. Colonoscopy is the best way. So let me give you a little overview of what does a 5-year survival of colon cancer looks like depending on the stage of the cancer. If it's diagnosed in stage 1, the 5-year survival ranges between 90 to 95%. If it is diagnosed in stage 2, generally speaking, 5-year survival is about 60 to 65%. If it's stage 3, the survival is about 45-50%. Stage 4 is about 15 to 20%. 5-year survival, meaning those numbers are pretty much enough to tell you that the earlier the stage is, the better the chances of beating this cancer. So it's very important to find it early. That means if you are one of those people who are over 45 and you haven't had a colonoscopy, please do it because it is a very treatable cancer. Once we understand that part of it, now the staging, the risk of recurrence makes sense. Now let's talk about that first part. You're diagnosed with, let's say, stage 1, 2, or 3. We will not cover stage 4 at this time. In stage 1, 2, or 3, when you ask your doctor, what is the chances of this cancer coming back? Usually for stage 1, the chance of it coming back is about 5 to 7%. In stage 2, that increases to about 10 to 25%. In stage 3, that increases to 25 to 35%. That means there's about 25 to 35% chance that the cancer will come back. Where can it come back? 2 parts to it. It can come back within that same area, or it can come back at a different place. We call it distant recurrence or local recurrence. So local recurrences meaning coming back in the same area, distant recurrences meaning coming back in somewhere like liver, lungs, bones, peritoneum, etc. So once you understand these areas, you also know exactly why they're doing what they're doing. We'll talk about what do we do to prevent the recurrence or decrease the chance of recurrence, and how do we do surveillance moving forward. Thank you very much for your attention.